Morning, everybody. Joe Joseph here for thedailySheeple.com, and this is your news shot. So, as Activist Post has a wonderful piece on something that is extremely front and center with a lot of people these days, free market alternatives to Obamacare. Folks, healthcare is getting absolutely and totally, completely overpriced, out of control, and more people are being left in the lurch with serious health ailments that only a few years ago, were commonly covered and easily affordable, and now are out of reach of a lot of people. Jeff Paul writes, why do car insurance companies charge more for teenage boy drivers? Well, because they pose a higher risk of filing an insurance claim for accidents, mud bogging, speeding tickets. Insurance companies must manage a pool of risk against potential expenses. Riskier participants pay a higher premium. It's not rocket science. Yet healthcare companies are now prevented by Obamacare law from charging a higher premium to riskier clients. Thus, the cost of insurance premiums and copays have been raised on healthy people to absorb this perversion. Today's health insurance costs about the same for a family of four as a mortgage payment for the typical single-family home. If, God forbid, you actually needed care, the yearly deductible is usually equal to yet another annual mortgage payment. And if you fail to purchase this overpriced garbage, you get fined by the government. Can you say mafioso racket? Shortly into his administration, Donald Trump, of course, signed his executive order minimizing the economic burden of the Patient Protection and Affordable Care Act pending repeal, basically instructing the IRS to ignore penalties under Obamacare. Now, this, of course, set the tone for what many hoped would be a repeal of Obamacare, but doesn't look like it's going to happen. And now you have a couple of options to save you money on health care, no matter what bill gets passed, okay? This is the important thing to understand. Doctors are actually kind of moving away from insurance because it's just like the article says, it's a racket. But there are some free market alternatives to Obamacare. The first one, of course, is health savings accounts. Now, to qualify for a health savings account, you got to be enrolled in a high deductible health plan that doesn't cover all your medical expenses. Now, most plans these days actually qualify for that. Now, there's three advantages to health savings accounts. You fund them with pre-tax income. The account value grows tax-free, and you can spend funds tax-free if you use qualified medical expenses. Now, funds in an HSA can be invested similar to an individual retirement account, just as with self-directed IRAs. Health savings accounts can also be self-directed into CDs, to stocks, bonds, mutual funds, real estates, precious metals, anything like that. Plus, once you reach the age of 65, all non-medical withdrawals are taxed at the current tax rate, just like an IRA. Also, like some retirement accounts, there are contribution limits. So for 2017, the deposit limit is $3,400 for singles, $6,750 for families. 2018, a little bit higher. Then, of course, you have a flexible spending account. And those are similar to HSAs, except FSA funds must be spent in the same year. So it's tax-free as long as you spend it on medical expenses, and the limits are a little bit lower. I think it's $2,600 a year per employer. If you're married, it's $2,600 a year for you and then your spouse. But these are another way that you can use it. Now, most companies will have FSAs. Very few of them actually have HSAs. But another thing you could do is a health sharing ministry or cooperative. Now, these healthcare ministries that are out there, these are organizations that facilitate sharing of medical costs among individual members who have common ethical or religious beliefs. Now, these cooperatives were grandfathered into the Obamacare law, so they can be much less expensive than insurance, but they typically have stricter health standards for participants. Health share ministries exclude some pre-existing conditions which affect about 5% of the applicants, and most conditions can be corrected and managed by lifestyle choices. That's what And that's why these cooperatives really are, they offer affordable options to kind of get the ball rolling should you not be able to afford, a silver or platinum or whatever the hell plan they have out there now. And finally, concierge medicine. Now, this is something that's up and coming, and a lot more doctors are moving to a concierge model of healthcare than actually going with the, your traditional insurance market. And what that is you pay a concierge fee, whether it be a monthly, quarterly, annual retainer, directly to your doctor or practice, and they become your personal health team. Now, concierge service limits the number of patients they see, which gives you a bigger, more time to spend with the doctor. So a typical or traditional doctor that goes through the insurance companies, on average, to stay profitable, has to see a patient every 7 minutes, because what they bill the insurance company versus what they get paid by the insurance company is vastly different. So instead, you pay a monthly fee. Now, my wife has her doctor. It's a concierge model. And it works out very well, because when she goes to the doctor, sometimes she spends an hour with the doc. And you get to talking, and you can get more in depth on the health issues and actually get somewhere, instead of, okay, well, what are you here for? That's great. 7 minutes. Here you go. I'll just treat the symptom. The hell with the problem. And we'll see you in 6 months. And that's the primary issue that you have with your traditional health model. So concierge, you'll find more and more doctors across the country are using this model of service, and they're ditching insurance altogether. Some of them will use both, but in all cases, the concierge model have taken practice sizes down dramatically, from practices having 3,000 or 4,000 patients down to 500. And it's done wonders for doctors to be able to sit down with their patients and actually be a doctor, which is something else. There is one other thing, medical tourism. If you go to different countries, a lot of these medical procedures are a lot cheaper. Down in Costa Rica, you can get $15,000 worth of dental work done for about $5,000. Your travel and lodging will cost much less than the $10,000 you save. You can go down and get dental work. You can go down to Mexico, go over the border, get cosmetic surgery, any orthopedic surgery, fertility treatments. All of these are much less outside of the United States, because, we are the first. We're number one. That's the most scary thing. When you take a look at American healthcare, we've been sold a bill of goods. Oh, yeah, we're America. We're number one. We're not number one. We're nowhere near number one. If you go to these other countries, the medical care that you get, sometimes in third world countries, far exceed what you can get here. And it's really sad that greed has gotten us to this point, but it has. Are you telling me that it's cost, like $500 for a bag of saline water? That's what hospitals charge. Why? Because they want bigger and better hospitals, and they want to make their profits, and they've got shareholders they have to answer to. And that's what it all boils down to, folks. Not your health, but the bottom line. And as long as these health insurance companies are making buku bucks, they're going to keep pulling back the benefits and ratcheting up the prices. And they'll find any way or excuse to do it. I'm Joe Joseph. This was thedailysheeple.com's News Shot. Feel free to comment below and visit our website at thedailysheeple.com. Have a great day.